Welcome, everybody. I'm Sandy Scheinbaum. I'm founder and CEO of the Functional Medicine Coaching Academy. And I'm here with Elyse Wagner. She's our co-founder and my partner, and we're excited to be with you and want to answer the questions that you may have about FMCA.
So hello and welcome. Thank you so much for being here today. We're just going to dive right on in, and Sandy and I will switch off taking questions. And so here we go. So Andrea writes, what are the prerequisites for this course?
The prerequisites are passion to serve others, to really feel in your heart that you want to make a difference in this world, to help people get healthier. You don't need to submit credentials like being a college graduate, for example. The research shows you don't have to have a background in healthcare, just wanting to help others.
Yes, absolutely. And everyone who comes to our doors has a passion to want to serve. So Jennifer asks, what is the time commitment required for the course and when do the classes start? So our classes start twice a year, September 1st and March 1st. And the time commitment required is usually around 10 to 20 hours. It really depends on the type of learner that you are. So we like to say set aside 10 to 15 hours, a little bit more if you like to watch and then read, but we also have the audio available for you to just listen. You can also read the transcripts. So there's many different ways to consume the content.
Absolutely. We accommodate all kinds of learners.
And Gloria asks, where will I be qualified to work?
Well, the sky's the limit. It's really runs the gamut from working in a medical center, a major clinic. You can work for a doctor, a functional medicine doctor, a doctor not trained in functional medicine. You can always work on your own. We have many people who've gone through our program who are starting programs, amazing things. They're working in schools, they're working in corporations, they're working in many different areas.
I would agree with that. There are tons of different ways that you can utilize this certification and serve your communities. And really the sky is the limit and you can incorporate all of your passions. So it's a beautiful thing. So Lisa asks, what is the total cost for the certification and how much time does the program take to complete? So the cost for the certification, typical standard tuition is $7,997. And what I would encourage you to do is throughout the period that we're promoting for the enrollment and the course, the upcoming course, I encourage you to reach out to our admissions team, and they will support you and share with you any financing options, payment plans, and they will also let you know if there's any promotional advantages as well. So I encourage you to reach out to us over at admissions. You can reach out a couple different ways. You can email us at admissions@functionalmedicinecoaching.org. You can also call us on the phone, and you can reach us between the hours Monday through Friday, 9 a.m. to 5 p.m. Central Standard Time. And the phone number is 855-270-3622 or FMCA. Again, it's 855-270-3622. And one of our admissions team members who's actually gone through the program would be more than happy to support you and answer any questions that you have. So Renee asks a question. I understand that this position can be utilized in other fields, such as working with seniors in a residential environment. Could you give me other examples where health coaching experience could be used besides the medical field, if any?
Absolutely. So many of our graduates have worked in another field before coming to us. And so they continue with what they're presently doing, but now they're using the coach approach. So we have many healthcare professionals who are doing now coaching. They might be doing this on the side. Another possibility is to go into the educational system. We have graduates who are teachers and now they're designing curriculum based on functional medicine and coaching. Corporations are really hungry for good programs that have to do with wellness for their employees. And so we are looking at really preparing people very well to work in those areas. You had mentioned working in a senior facility, and that is another option as well.
So Judy asks, what makes your graduates credible in the community?
Oh, I love that question. And when we first started, so we are collaborating with IFM, that's the Institute for Functional Medicine. So they are the global leaders in functional medicine training for practitioners, for doctors, for example. And so we are the global leader in training health coaches. And it's really because of this partnership. We're so grateful because we have senior faculty from IFM who are our faculty. And so their resources become our resources. And so we are hearing all of the time that we are so well respected because of this partnership and access to some of the most brilliant minds in medicine today.
And Cynthia asks, as a health coach now, would you recommend using particular labs for certain testing? And if so, would availability for clients vary from state to state?
Sure. So we teach coaching. We teach the coach approach. And this is very important. Our graduates are eligible to sit for the exam for the National Board for Health and Wellness Coaching. They are the gold standard that is to become a board certified health and wellness coach through this professional organization. And as such, it's really looking at how to be a coach. And so the role of a coach is something that involves really inspiring people, how to help them on this journey towards change and often self-acceptance. And it may not be working with labs directly. So coaches who are working in clinical practices may be very familiar with those labs and rely on the recommendations of the functional medicine doctor that they're working with. So we teach you those labs, but how to use those labs, most importantly, as a coach so that you stay within the scope of practice for coaching. And within that scope, there's so many wonderful things you can do to inspire people.
So, and Jill asks, do health coaches generally work on their own or alongside functional medicine doctors? And we can tag team this one, Sandy. There's a lot of ways that health coaches can work. We typically see that health coaches who are very entrepreneurial go out and start their own practice, whether it's in their community or online. We've also seen coaches work alongside a functional medicine doctor or practitioner within their practice and on a collaborative care team. We've also seen a hybrid of both of those. So sky is the limit. And we've also seen health coaches go into more of a corporate wellness setting as well. So there are plenty of ways that coaches can work. And I'll turn it over to Sandy as well.
So a great way that coaches can work with functional medicine doctors is going into those practices and leading group visits. We strongly believe that group coaching is the way of the future, and this doesn't have to be live. They can run a virtual group just as they can do one-on-one sessions virtually. So it's another great way, and our program is 100% online, but the interactions through the live training sessions are live virtually. And this is a growing model for coaching to be in the telehealth realm.
And Michelle asks, would you please address the legal aspects of functional medicine coaching? Specifically, where does functional medicine coaching stop versus an MD of functional medicine? What are the limits of functional medicine coaching from a legal aspect? What resources are there to help us navigate? How can I basically find what I can and cannot say or can and cannot do? This is kind of a gray area. Mm-hmm.
So it is a gray area, and we teach the coach scope of practice. We have an attorney who specializes in this area, who has done seminars for us, Ask the Experts, where we bring on people to where you can ask those specific types of questions. And a coach does not diagnose or treat. They do not order lab tests. They do not prescribe supplements. They are not practicing medicine. So we give lots of examples of how you use particular language to stay within the coach scope of practice. You are an educator. You are someone who inspires people. My mentor, Frederick Hudson, has said that a coach inspires passion and purpose in others. And that's such a wonderful role to be, and that is what a coach does. And so that's what we will be teaching you, all the things that you can do within that broad sense of how you can inspire someone to go from where they are to where they want to be. And then we leave it to the medical professional to order the labs, to make the diagnosis, to act as the expert.
Yeah, absolutely. And Amy asks, does health insurance cover visits to health coaches, or would our practice need to be cash only business? What do most health coaches charge?
So there are ways that coaching is covered through insurance, and it is done through the clinic. So you, as a coach working on your own, that you don't have a license to practice. And so you would not be making a diagnosis and submitting that to an insurance company. If you are a coach who is working in a clinic, the doctor in that clinic can use a particular diagnosis, for example, to conduct group medical visits. And as the coach, you could be leading those medical visits. And there's some good models in place where those are reimbursed through insurance. As far as what you can charge, that varies. So we do surveys frequently. It depends on what part of the country. It depends whether you're doing one-on-one, whether you're leading a group, whether it's virtual or live. So there's so many variables involved that these are some of the questions that really we look at the surveys. So, it's very difficult to say. There's no one number that is out there. It's based on your level of experience as well as your comfort level, how your relationship to money may impact what you're comfortable charging.
Yeah, I'm so glad that you brought that up, Sandy. And I'd also just like to encourage everyone that when you do join us, you get access to Sandra and myself, our office hours. And these are the very questions that we get and that we help our individualized students with. And so if you had a question about this that you wanted one of our assistants with, or some support and feedback or a sounding board, we are happy to do that and happy to offer that. And we offer office hours 4 times a month. So 2 office hours between both of us. And that's one of our favorite times.
Yeah, absolutely. So you would bring that question, what should I charge? And then we would brainstorm. And there might be a few other people on the call as well. And so we would help you arrive at a figure that you're comfortable with.
Mm-hmm. So Megan asks, will this be a recognized certification if you don't have a medical background? And do you help with job placement?
So this is a recognized certification. When you graduate from FMCA, you get a certificate of completion, because we are not a board certifying body, but we are so fortunate that we are an approved school. We have gone through the transition phase from the National Board for Health and Wellness Coaching. And now we've reached that second level, which only a few programs in the country have this recognition, that we are in this next phase as an approved school for the Health and Wellness Coaching Board certification, meaning our graduates can sit for that board exam, and that is the gold standard. And so that's would carry a lot of weight, that you would be a national board certified health and wellness coach. And there was a second part to that question.
Yeah. So the question is, any help with job placements?
Yes, absolutely. We have a graduate directory on our website. We also have a director of alumni development, and we have a growing number of practitioners who are coming to us to post a job description, and that's growing.
Okay. So Eileen asks, are you finding that most of the FMCA grads are establishing independent coaching businesses, and how many of your grads have taken the International Board Certification exam?
Sure. So it's mixed. We have, because we're functional medicine, many of those people setting up their practices, we're connecting with functional medicine doctors. And then there are those who are already working in a practice, or from the time they start as a student, they're already talking to people in their community about functional medicine, because the number of functional medicine doctors is growing at just a really fast rate. And so there's a lot of demand out there, and we've seen this increasing. And so because of our association with IFM, when IFM has a training program for doctors, they are talking about the importance of starting this functional medicine clinic with a coach. So many people are on their own as coaches, but they are getting referrals or they're going into practices. So it's some combination.
And Ronnie asks, what's the difference between the coaching program and the IFM certification?
So the IFM certification is for the practitioners. They go into a lot of detail about the underlying science, about how to prescribe medication, labs, and we are going into great detail how to inspire people through positive psychology, for example, through mind-body medicine strategies. We also do cover, though there is overlap, I must say, in the basic functional medicine concepts. So the basic underlying principles of functional medicine, key resources, the IFM food plans, we teach those to you as you would use them if you were a coach.
So Deborah also asks, is there a set amount of time that this gets done over? How flexible is it, considering life circumstances, if they become too difficult and it has to be stretched out or put off a bit? How rigorous and demanding is the program? She's asking also about homework and testing, and any suggestions for how to work in the field. What are the ways to do that? And is there ongoing support? Lots of questions. Awesome, awesome. We can cover a lot in this question.
So let's start by, it is a 12-month program. And within the year, there's a lot of flexibility. If you want to listen to a recording on your way to work while you're taking a walk, there are live training sessions that are scheduled, and you would choose one that's convenient for you at a day and a time zone you know that you can make. So we have people who are adult students, and that means that you have work, you have family obligations, and so it's not like going back to get a master's degree where there are midterms and really strict, final exams and huge papers you have to write, and all those memories you may have about being in undergrad or graduate school. It is not like that. So you learn in the way you choose to learn, and there's tons of resources and support available, because we know that we've had experience with students who've had a life crisis come up, an aging parent, or issues that are pretty stressful, and often the first tendency is to want to drop out or defer. And often those who stay in the program find that it was because they were a student at FMCA that they got through that crisis, that they were able to handle it, that they had resiliency, because what we teach, particularly through positive psychology and the power of being in the cohort group with fellow students, is you feel enriched by using your strengths as well as being part of this community. And so the feedback we get afterwards is, oh, I'm so glad I didn't drop out. I'm so glad I didn't defer, because it was this community that got me through it. But there may be circumstances where it really is a necessity to turn 100% of your attention to this particular crisis. And we do have, but we do have students who defer, and they can start again when with the next class beginning.
And I would just like to add to that if you do have questions about, or any other questions regarding the course or the coursework, or potential for deferring, what that looks like, you can always reach out to us at admissions@functionalmedicinecoaching.org. You can also reach us by the phone. Our phone number is 855-270-3622. So you can always chat with one of our admissions team members who is also a graduate of the program. Michelle writes in and she says, I'm interested in the Bredesen protocol from the book End of Alzheimer's by Dale Bredesen. What are your thoughts on this program, and are you able to integrate this into any of the training?
So we are partners with Dr. Dale Bredesen and his group, because we launched a specialty course that is reversing cognitive decline training for health coaches. This was built in collaboration with Dr. Bredesen. He is the main teacher for the course. This course is tailored for you as a health coach. It is available to our graduates and other certified coaches. And so we have a strong association with Dr. Bredesen. And so this has been a very valuable course. Those people who have gone through it are now able to get referrals to work with doctors also trained in the Bredesen protocol.
And if you want to learn more about that, you can actually visit our website at www.functionalmedicinecoaching.org. And there is a program tab. And when you click that, you can hover over and select specialty courses. And you can learn all about the specialty course that we have on reversing cognitive decline. So Mona asks, how does this course differ from IIN, Functional Diagnostic Nutrition, Functional Nutrition Lab, and School of Applied Functional Medicine?
So FMCA is a form of collaboration with the Institute for Functional Medicine. So we are partners with IFM. We teach functional medicine principles, and we have our faculty is senior faculty from IFM. We are also a permanent approved school from the National Board for Health and Wellness Coaching. And we focus on this unique blending of positive psychology coaching with the functional medicine principles. So this is a model that we developed, and are proud to say that we are the global leaders in this area.
And I would also add to the difference between us and some other programs. There's no right or wrong program. It's whatever's going to fit for you, but definitely the collaboration, and you're learning from the top leaders in the functional medicine world and their industry, as well as the world from positive psychology. And you also get an amazing support system when you come into our family. Sandy and I are available in our office hours. You are working in a small cohort of about 12 other students. There might be a bigger class surrounding you, around 300 to 500 students. But you also get a course facilitator, so someone to really support you, someone who's gone through the program to answer your questions, and to just kind of help guide you and give you feedback as you are meeting in your live training sessions. And so there is a lot of support, as well as there's a Facebook group, there's discussion boards. So the community aspect is huge. So if you've ever felt like, am I the only one interested in functional medicine or positive psychology, or, I believe that food is medicine, or just finding your tribe and your community, that is something that we just have an abundance of, and everyone is here to support. And our motto is a rising tide lifts all boats. And so that is pretty evident in our community. Everyone is willing to jump in and help out. So. Next question is Pamela, and Pamela asks, can a doctor become a health coach? And that is yes, absolutely. Anyone can become a health coach and a functional medicine health coach. And what we have seen is that with a passion to serve, it is possible. So we welcome you to reach out and ask us any questions that you have.
Absolutely.
Linda asks, will the FMCA coaching class give me adequate background and the knowledge to give lectures in elementary, love this, and secondary schools to improve health and nutrition levels for our malnourished urban poor minors?
Oh, absolutely. And we have graduates who are doing this. We have high school teachers who've come and become FMCA coaches, and they're bringing this back to their school. They're developing whole curriculums. And absolutely, we are big proponents of going out to your communities and work with this knowledge to help inspire people and work with kids. I love hearing about what our graduates are doing, and Elyse and I love to support them. So people are always coming back excited about the initiatives that they're doing.
Yeah, absolutely. And this question is actually kind of along the same lines. So I just want to reiterate that you can, there's so many opportunities, but Christina asks, what are the opportunities for applying my certification as a functional medicine health coach to working with children with special needs?
So absolutely. So you can coach families, you can give community talks. So really the opportunities are endless, and I love hearing about how creative our graduates are and the amazing things that they're up to, writing books, doing podcasts, writing blogs, connecting with doctors in the community, and leading groups where you can work with families of children with special needs and help them through the amazing power of functional medicine coaching.
So Stephen asks, is your training relevant to patients or practitioners based in the UK or Europe? Is it very USA oriented? Thank you.
Well, we have a lot of international students, and particularly in the UK, where functional medicine is growing and coaching is growing, and we have been told that there is more demand. And so absolutely. So we really do cater to not just people in the United States, but the global community.
And Sarah asks, I discovered my passion for functional medicine after I had my human resources bachelor degree. I guess the qualifications are different, so are the job opportunities, but I want to be able to help my family and friends and be credible. At the same time, I want to learn more about health and how our bodies work. I guess my question is, will the program be right for me, as I'm confused and I want to venture into the world of functional medicine? I want to make sure that I'm learning the right information.
So the program really focuses on the experience. We nurture you and support you so that you are trained to feel confident as a coach, confident as an individual in all of your interactions. So we provide information, we provide knowledge, but you can get that in many different ways. When you join us, you join a community of fellow learners, of faculty, Elyse and I, that we are available to help guide you, to support you in this journey towards becoming a coach, which, as we have been saying, has endless opportunities, so that you don't have to feel restricted by your past training or the vision that you may have. So we encourage people to dream big, to pursue what they're so passionate about, and then help you with the knowledge and training to get there.
Yeah, and I would just add as well, Sarah, and this is really for anyone who has this question, and that's a great question to ask, is this program right for me? And we are more than ready and willing to sit with you on the phone and to answer any questions that you have and help you determine that. Because like I said before, there's no right or wrong program. It's what's the best program that's going to fit for you and what your needs are and where you want to go. So I encourage you and all of you to reach out to us. Call us on the phone, 855-270-3622, or you can email us, admissions@functionalmedicinecoaching.org. We're more than happy to answer your call and hop on the phone with you and get any questions that you have answered. So, and just really serve you and help you find the answer for what works for you. So one more question, and that's from Natalie, and she wants to know how much nutrition knowledge is included in the program, and would this be useful for an entrepreneur who's looking to set up a wellness space?
Sure. So we have developed our curriculum in collaboration with IFM, Institute for Functional Medicine, And so the experts in nutrition who taught for IFM teach for us. And so we cover some very, very basic principles of nutrition, such as macronutrients, micronutrients, and more specifically, we dig into the specialized IFM food plan, starting with an elimination diet. So you will have those resources. We have handouts for you so that you will know how to support people through these food plans. So if you are working with a functional medicine doctor and they say, I want my client on the elimination diet, I want my patient on, so that you will be able to support them through this elimination diet, through a subsequent food plan. And so as somebody who then understands these plans, you will be able to support individuals through them. So we do not train people to become nutritionists. That is a whole different specialty area where you are the expert. We're training people to be coaches, to really help people to feel empowered to make those steps towards however small they might be, to take those steps towards changing their diet. But it's not just diet. We could be focusing on if the client wants to talk about exercise or managing stress, then that's where the coach would go. And we cover all of those things.
So those are the answers to your questions. Just want to say thank you so much for submitting all of those questions. And again, what other questions that you might have, please reach out to us. We are more than happy to support you and help you answer those questions. And you can reach us at admissions@functionalmedicinecoaching.org, or you can call us at 855-270-3622. And we are available Monday through Friday from 9 a.m. to 5 p.m. So we look forward to hearing from you and to serving you. Thank you so much.
Thank you so much. Thank you for listening. Bye now.
Bye-bye.
Bye.